All right, let's talk about the long way. So when I talk about the long way, I kind of break this into 4 phases of training. Now, often, if you're really lucky, if the stars are aligned perfectly in your favor, more than one phase occurs at the same time. But the 4 phases essentially are daytime urination training, so P training, and there's 2 sub-phases to that, what I call trip training and self-initiation training. So this is P training. Similarly, we've got poo training, daytime bowel training, and again, we've got trip training and self-initiation training. Now, really, there's 6 phases, but I'm not going to talk about the other 2 today because I think we're not going to have time, and that's nighttime pee and poo training. Okay, if we have a little time at the end, I'll kind of tag some of that on, but nighttime is, you know, kind of lower on the priority list for me and for most families. I mean, it's swell because now your kid can go to camp, now your kid can go to sleepovers, now you don't have to clean sheets, blah, 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 blah. But in terms of the grand scheme of things, the social impact of not being toilet trained, night training is somewhat lower on the list. As I said, if we have time, we can get into it, but I'm not promising that. So, yeah, so these are the 4 phases. Now, as I said, often this will just flow into this. Flow, get it, flow? Yeah, I know. Often this will happen at the same time as this, right? So sometimes these are not separate phases, but if they are, we need to know how to approach them as separate phases. So like I said, if you're lucky, it all kind of happens, some of these things happen together. So let's talk about phases 1 and 2. Now we're talking about P training, okay? The first thing I want you to appreciate is a little bit about the anatomy of this and the difficulty that's involved here. So here's what happens in your body with regard to urine. Urine is made in the kidneys, right? The blood flows through the kidneys filter out all the stuff that shouldn't be in your blood that you want to get rid of. It then flows down these tubes called the ureters that connect the kidneys to the bladder. It empties into the bladder, okay? And then when you want it to, if you're toilet trained, it empties through this little teeny muscle called the urethra. You pee, okay? The trick with toilet training is as the bladder gets full, there are sensors inside of it that make you feel uncomfortable, right? And when you feel uncomfortable, you actually clench this muscle, this urethral muscle, tighter, right? Unless somebody makes you laugh, or unless you sneeze, in which case you want to kill them. Right? Well, maybe that's just me. Okay, never mind. Okay, you clench tighter until you get to the right place, this place we call a toilet, and then voluntarily you release that muscle and the urine flows out. Okay? That's how it works. So in girls, the urethra is down here. In boys, the urethra is up here, right? And those muscles have to relax at exactly the right point in time. That is when you're standing or sitting at a toilet, right? These teeny tiny muscles that you can't see, that you can't touch, and that you can't explain to the person who's being toilet trained even exist, have to relax at exactly the right moment so the urine can come out in exactly the right place. That's hard. I mean, we take it for granted because guess what? We're all toilet trained. We go, oh, how hard could this be? But in fact, you know, we're talking about people who have significant learning challenges, right? Some people who have difficulty telling the difference between a car and a ball. And now we're trying to convince them that this little teeny muscle that they've never seen and they can't touch is a muscle that they need to control and relax at exactly the right point in time. Even if we don't explain it to them that way, of course we wouldn't. We wouldn't say to the 3-year-old, honey, let me tell you about your urethra. Right? It's this little teeny muscle, blah, blah, blah. And Dr. Mirenda said you have to relax it at exactly the... We were not going to tell him that, but that's what he has to learn. He has to learn the feeling of bladder fullness, how to clench that muscle to keep the urine in until he gets to the toilet, and now how to release it easily once he gets there. That requires good teaching and good motivation. So my point is, this is not an easy thing we're trying to teach. This is not an easy thing. It's amazing that any of us are toilet trained, frankly. You know, it's just amazing. So we need to think this through. We need to be very, very planful. So the first couple of things I want to talk about is not about training. It's about getting ready to train, right? Let's think through the getting ready stuff, okay? If you have any concerns in your head at all about medical issues that may affect urination training, go to the doctor and find out if you're right? If you're in the least bit thinking, my kid might have a neurogenic bladder, oh my God, right? I doubt it, but never mind. If he has frequent bladder infections, if he has a known urinary tract disorder, if he or she has any kind of medical thing at all that you are even thinking might impact the ability to be toilet trained, go to the doctor and say, is this problem that this person has something that will get in the way of toilet training? Okay. My guess is that 99.999% of the time the doctor will say no, but I think you need to know that as a parent, as a professional, you need to know in your head, it's safe to do this, and there's nothing about my kid's anatomy or physiology that's necessarily going to get in the way. Because if you're thinking that there is, then when the going gets tough, you'll fold. You'll think, oh, well, he has blah, blah, blah. That's why it's not working, right? So make sure that blah isn't getting in the way, whatever blah, blah, blah is. Does that make sense, right? Okay, and the same thing goes for bowel training, by the way, right? We'll talk about that when we get to poo, okay? So if there's any question in your mind, go to a doctor, have your kid checked out, make sure everything's working fine. Now we've gotten the medical checkoff for the child, now it's time to get a psychological emotional checkoff for you, okay? So you need to prepare yourself. You need to, and I'm saying this to those of you who have been trying to toilet train and are now frustrated because it hasn't worked, you need to somehow have a chat with yourself in your head to understand that this is an instructional challenge. This is not a kid with a behavior problem, as in, he could do it if he wanted to, he's just being stubborn. This is not what's going on here, right? He thinks he's supposed to pee in his diaper. That's where he's always done it since he was born. Right? And so far, nothing has convinced him that he's supposed to do it someplace else. Right? So if he can hold his pee for 8 hours at a time when you don't put a diaper on him, it's because he's thinking, where the hell's my diaper, Mom? I gotta pee. You're thinking he's just being stubborn. He's thinking, give me my diaper. Right? Because that's where he thinks he's supposed to do it. Honestly, I'm telling you, right? Those of you who are behavior analysts out there, you know we have a name for these things. This is the stimulus control problem, right? The diaper has stimulus control over the peeing, right? He thinks that's where he's supposed to do it. So do not frame this as a behavior problem, like he could do it if he wanted to. He's just being stubborn. This is an instructional challenge. We just need to get him to the point where he he pees, even though he thinks he's supposed to do it in the diaper, he eventually pees in the toilet. Right? So don't frame this as a power struggle between you and the kid or you and the adolescent. It may feel like a power struggle, but you need to get very zen about this. Right? You need to have a strategy to stay calm as you're doing the training and not get frustrated. You know, a little breathing exercise, right? You need to have rewards set up for yourself. I'm totally serious about this at the end of the day. If we get through the day and I'm successful as a teacher, even if he doesn't pee, I do my job as a teacher. I get my glass of wine. I get my bubble bath. I get my pint of Haagen-Dazs, whatever it is that's rewarding to you, you know, right? Right? They're called accidents for a reason. They're called accidents because they're really accidents. Right? He's not peeing in the wrong place just to get to you. And this is so important. I work with so many families who are so frustrated, right? And they're just sure the kid's out to get them, right? And it's really hard to be a good instructor if you're in a power struggle with somebody. So do your best to kind of zen out about this and prepare yourself. Seriously, because your mental health is important to me. Not just the peeing, but your mental health. Okay. The next thing we need to think about is who's going to do this, who's going to be the toilet trainer or trainers, and where is it going to happen? It's not necessary, it's easier, frankly, but it's not necessary that it happen at a home and at school simultaneously. So if home is ready, but school isn't, or if school is ready and home isn't, one could do it without the other, right? What will happen is, if school does it, for example, and home doesn't, in the beginning at least, it's possible that the kid will be toilet trained at school, but not at home. Or toilet trained at home, but not at school. Right? Like generalization across the environments may or may not occur, probably not. Right? But at least when school people say, you know, often when I work with school folks, they'll say to me, well, you know, this kid's 10 years old and, you know, the parents are exhausted. They've tried to train him. We'd like to train him now at school, but the parents won't cooperate. Fine, let it go. They're exhausted. They've given up hope that this can happen, right? I don't blame them, actually, for giving up hope because they've been trying for 10 years to make it happen and it hasn't happened yet, right? So what I say to school folks is, fine, train him at school. Figure out how to train him at school. And when he's trained at school, you can then go to the parents and say, you know, we think we figured out how to do this. Now we'll teach you how to do what we did at school. You can give them back hope about this, and vice versa. Sometimes I'll say to parents will say, you know, the school's like saying, we're not spending any more toilet training. Ugh. Fine, train them at home. And then when you're successful, teach them how to do it the way you did it. It doesn't have to happen in both places. And it breaks my heart when toilet training is stopped because two groups of people are fighting with each other about one group, one half of the equation not wanting to cooperate. It's not about not wanting to cooperate. It's about we've been doing this for years and we're exhausted by it. We're exhausted by it. Right? So don't let that get in the way. If you're on one side of this equation or the other, do your job. Don't worry about the other side. Once whoever has decided to train, whether it's school, home, or both, now we need to decide as a team which actual people at home or at school have the commitment and the motivation and the energy and the time to do this. And who will really be able, remember we're talking about the long way here, to follow through with the program for, you know, up to 3 months, right? Who's ready to dig in? Is it mom? Is it dad? Is it grandma? Is it the nanny? Is it mom and dad? Who at school? Is it the SEA? You know, is it the teacher? Is it both of them? Is it someone else? Who's the point person here who's going to take responsibility? And some of that has to do with who is willing and able to get rid of the diapers. You can't train a kid in diapers. Or, you know, absorbent pull-ups or cutie pewtie, you know, Dora underwear that absorb. You have to have kids in real underwear, right? And the reason is because he's used to the feeling of that warm, cozy, oh boy, feeling in the diaper. And you want that feeling to no longer be there, right? You've got to get rid of the diapers. You've got to get rid of the diapers, okay? Or the pull-ups or the whatever, right, that is now wicking. They're great because they wick the moisture away from the skin. So now I'm really wet, but I can't feel it. Yahoo! Which is great for my skin and bad for toilet training. Okay? So, and furthermore, you can't easily tell whether he's wet or dry, and neither can they, because of this wonderful wicking that happens with these very absorbent modern appliances. Okay? So in the toilet training setting, the person needs to wear underwear. So if he's being trained at school, he needs to be in underwear at school. He can be in pull-ups or diapers at home if home is not toilet training. He can be in pull-ups and diapers at night because you're not training at night, right? But when you're training, he's in underwear with waterproof pants, obviously, over the underwear for hygienic reasons and to protect the clothes and blah, 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 blah. Okay, so if he's being trained in both home and school, he needs to be in underwear in both environments. Only at home, underwear at home, pull-ups at school. Only at school, vice versa. Nighttime isn't even on the table right now. Okay? Speaking of waterproof pants, there's a company called Gabby's. Gabby's.Net. Okay, it's a Canadian company, and they sell breathable, waterproof pants that are very sturdy polyester, very soft and silent under the clothing, so the kid isn't walking going quick, 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 right? Which is not a good thing socially. And they come in youth sizes and they come in adult sizes, you know, very big. Adult sizes are more than 100 pounds. The youth sizes start at 16. The adult sizes start at 13. The adult sizes start at 16. You may need to put like a maxi pad between the underwear and the waterproof pant if the kid has really good bladder control and can hold for a long time, so that if he floods, like if he's totally flooded, the waterproof pants aren't going to hold it, right? Like not going to hold it, right? But for most of the time, they do a pretty good job. By the way, Gabby's also has like a whole bunch of other things. They have adult diapers. They have swim pants for kids, adults, and youth. So if your kid's not going swimming now because of the toilet training problem, they have a solution to that. They have many, many things. I get no commission from Gabby's. They just happen to be a Canadian company that has a wide variety of products. So, I mean, you can get waterproof pants that aren't crinkly and that are big enough for the person that you're supporting if you need to. But you've got to get them out of diapers. You've got to get them out of diapers.